Hello, everyone. My name is Brenda Ahenkorah, CEO and founder of My Well Self. And again, welcome to our wonderful series of learning more about the wonderful wellness providers that we have out there. If you forgot, I've mentioned it quite a few times, but if just in case you forgot, My Well Self is a tech-enabled wellness-focused care navigation platform, and we are helping people to access personalized wellness treatment. And with that, today, I want to introduce Christine Lang. She is a traditional Chinese medicine practitioner and acupuncturist. She is the owner of Lang Wellness Center in Barrie. And we're going to speak with her today about everything about traditional Chinese medicine and acupuncture. So welcome, Christine, today.
Thank you. Thank you. Great to be here.
Wonderful to have you. So I guess we'll just dive right into it. Why don't you start off by introducing yourself, please?
Sure. Again, my name is Christine Lang, and I'm a registered TCM practitioner and acupuncturist. And I'm the clinical director here at Lang Wellness Center in Barrie, Ontario.
Okay, well, great, wonderful. I think I'm going to start saying TCM as well, just so I can cut down
So much easier.
on the time as well. Full sentence. I'd love to hear more about your journey to becoming a TCM practitioner and acupuncturist. How are they different? Was it kind of the same kind of journey for both? Just how about that? Let us know.
Sure. So the difference between the two is really just a little bit additional training. So they're both really richly steeped in traditional Chinese medicine theory. But the TCM practitioner designation allows those providers to prescribe herbal formulas to patients.
Okay, I see.
So registered acupuncturists get the base training in TCM theory, and then when you layer on the herbal formulas and individual herbs, that then allows the TCM practitioner to prescribe herbs to patients.
Okay, so it sounded like the training wasn't separate. It kind of happened in parallel to each other.
Very much so. So my training was all together. The Humber program here in Ontario, they have the acupuncture and herbal training together. The Georgian program up here in Barrie is actually separate. So the acupuncture is a standalone program, and then there's an add-on. It's currently suspended, but there's an add-on herbal program as well.
Okay, great. I did not know that. I thought in my head that they were separate type of trainings. So thanks for highlighting that too as well.
The beautiful thing as well with our registration or with our class, our act with the government, we actually have an additional class of registration that our regulatory board is working on, and that's the doctor class of registration.
Okay.
So they're working on the requirements in order to enact that class for our profession, which would require our members to have roughly the same amount of training as another doctor title class here in Ontario. So a chiropractor, so roughly about 7 to 8 years of training.
Okay. Now, would that mean that they would be able to do more, quote unquote?
Yes.
For someone
it's difficult
like me?
to say right now simply because they don't have all of the particulars defined yet with the regulatory board for that class.
Yeah.
But when we look at other jurisdictions like British Columbia, they are typically treating more advanced cases.
Okay.
There are other areas, other jurisdictions of the world that allow point injections for advanced training. So there are other options for additional care that we can expand to when the doctor class is enacted.
Okay, great. Hopefully that comes out pretty soon.
I'm hoping. I'm really hopeful.
That sounds exciting. And with that, are both TCM practitioners and acupuncturists, are they regulated?
Yes, we are. So here's a fun fact for Ontario.
Great.
We were almost deregulated this year. So we became regulated in 2013. And on February 28th of this year, the Ministry of Health announced that they were going to deregulate our profession.
Did they say, can I ask why? What was the reasoning for it? Or do you know?
Because I know the reason. I was fortunate enough to have sat on our regulatory board since its inception in 2013 to 2018 and was well versed and well aware of some of the inner workings with the Ministry of Health. And they claimed, or their claim was that our registration regulations were, the original claim was working to ethnically cleanse those practitioners from mainland China was the original claim. We were sued to the Supreme Court of Canada, actually.
Wow.
And we've won. And we saved the profession. So we are no longer on the block to be deregulated in 18 months. The government has rescinded the attempt to deregulate us and acknowledged their error in not seeking out any stakeholder input. Anyone.
Yeah, it
So the
was
board
just
didn't know, the Ministry of Health didn't know, practitioners didn't know, the public didn't know, allied health professionals didn't know. The government just announced they were going to pull it. So it was hopefully just an oversight.
right.
And they have acknowledged the error. And for now, we continue to be regulated.
Okay, that's a lot of information. I was not aware because I'm so used to just using that as almost a check
Yep.
before I go see a health
We've
provider.
had a lot of
So
hurdles.
wow. Okay. Well, good news is that it's off the chopping block
Great
and
news. It's
we're
off the
moving on.
chopping block.
Okay.
Mm-hmm.
Good to know. Okay. So
Mm-hmm.
now positive stuff.
Yes.
Let's learn more about what you can do for us. And
Yes.
so what are some general health ailments? I'm not sure if I should address them separately or not, but maybe you can let me know. What are some
Sure.
general health ailments that TCM practitioners and or acupuncturists address?
Sure. So it really depends on what I've always trained my students. Find out what really lights you up. What
Okay.
lights your fire? Because we are a full scope. So when you are seeking care from a registered acupuncturist or TCM provider, you are receiving the full scope of care for this treatment. Now, there are other allied health professionals that can perform acupuncture. I'm sure you're aware.
Yep.
They can perform that within their scope, which means if you're seeing a physiotherapist who's going to be performing needling, they're working on musculoskeletal aches and pains of that nature. When you're
Okay.
seeing a registered TCM practitioner or acupuncturist, we have access to full scope of care. So what that means is we can treat you just the same as your doctor. So we can work on gastrointestinal, we can work on dermatology. My areas of focus are gynecology, fertility, hormones, as well as orthopedics. So mine are kind of at 180 degrees opposite. I have an undergraduate in kinesiology from Waterloo, which is really driven my interest in sports medicine and orthopedics. And having 5 knee surgeries myself and being told that I was going to need a knee replacement by the age of 35. I was 24 at the time, having had 5 knee surgeries already, and knew I wanted to go back to school, and just switched that into going back to Chinese medicine and studying Chinese medicine.
Wow. So it sounds like your drive was kind of driven by your own story.
I find that with actually most people that get into the profession.
Yeah.
You've either had personal experience or someone in your family has had personal experience with care. So we have access to full scope. So we can do fertility. My associate likes to dive into mental, emotional, and spiritual.
Right.
So he gets into the PTSD, anxiety, depression, again, whereas an allied healthcare professional wouldn't have that access within their scope.
Yeah. Okay. That's well understood.
So I treat kids, I treat peds. I've treated, 18-month-old kids, right up to, I've got patients that are in their late 80s, early 90s.
Okay.
It's a beautiful medicine.
I experienced it myself and I totally agree. But what I think I really want people to understand is that your base can address pretty much a vast range of health ailments.
Vast range.
Wonderful. That's great to know. Yeah.
And the beautiful part about it is the minimal side effects.
Absolutely.
What we generally see, I've been doing this for 23 years. The most common side effect I witness is a bruise.
Yeah. The little pinches can get a little
right. You can get that little zing. It just kind of makes you grab a little bit. Zing.
But once that's done, I think it's pretty much okay, right? That's good. Okay. And how are the TCM practitioners and acupuncturists, I want to say unique? You may have touched upon that a little bit, but how are they unique and how they address health ailments, if you can?
Perfect. So we view the body as a whole. So I find that going back to my example of my injuries, when you require care in a Western setting, it's very compartmentalized and it's the area of injury, and that's what's generally addressed. With Chinese medicine, we view the body as a whole. So when we're assessing patients, we're really diving deep into your health history. We're asking questions about all of your systems. We're diving into digestion. We're diving into sleep. In addition to the reason that you're there. So in addition to your chief complaint, we are also, a few of our key diagnostic indicators, aside from palpation, we look at tongue and we feel pulse.
Yes.
So those really give us a snapshot, if you will, of how the body's functioning. When we look at the tongue, different regions correspond to our different internal organs, and that gives us a picture of how they're functioning. When you take that in conjunction with the questions that are asked, we start assessing you the minute you walk in the door. We visually assess you. We listen to your voice. We watch you walk. We watch your posture. We watch how you respond to us when you're speaking. So we take everything into account while we're assessing patients.
Right.
So
Yeah.
depending on a patient's health history, if it's very complex, some practitioners may just do the assessment in your first appointment.
Yeah.
If not, if I feel I have a very solid grasp on the assessment, I'll roll into a treatment as well in the first appointment.
Okay, that's great to know. Yeah, I have also experienced the tongue analysis, which was again quite interesting for me.
Don't brush your tongues before you see your practitioners. Don't brush your tongues, and no colored candies.
Isn't that amazing? That's great. I was told that. I was kind of thrown off by it, but now I understand. I understand why.
Yes.
Okay. Now with that, can you tell me some myths that you'd love to dispel about TCM and acupuncture? What are some things you hear you think, oh God, that is not the case? And let's hear about them today.
My favorite one is the myth that it's hokey, woo-woo, fluffy.
Yep.
And my response to that has always been, first off, if it wasn't effective, it still wouldn't be here.
Yeah.
It's been around for thousands of years, and I've been around long enough to see products come and go that aren't effective. If it wasn't effective, it wouldn't still be here. It's used on racehorses and animals, and they can't differentiate whether or not it's effective. It either works or it doesn't. So the other challenge I find is that we're using a different language, and we're talking about a language that has been developed 5,000 years ago from a different culture. So because we're using terms like chi or whatever terminology we're using, it doesn't mean we're talking about something that's different than a Western medicine terminology. We're just using a different term.
Correct. Yeah. So it sounds like what I'm hearing, sometimes people are not really comfortable with the words that they hear.
Yes.
And for that reason, they may not think the treatment's effective.
Very much so. Very much so. We use very simplistic terms when we're diagnosing. We talk about cold, we talk about wind, we talk about the impact that they have on the body. And I think when you talk sometimes in simplistic terms, people don't believe that it's as effective. Or it's simple. There's nothing wrong with things being simple. Sometimes those are the most effective.
Yeah. Interesting point you brought up there. Interesting point you brought up there. Okay. So with that, thanks for dispelling some of those myths. Now let's imagine someone wanted to see Christine. Yes. What would a typical session look like with you? Is it dependent on what they're coming in for? Would it be standard?
It does depend on what they're coming in for. If we were having somebody come in, let's say for a chronic ailment, again, we'd go through the full health history. We'd really do a deep dive into the chief complaints so that we had a solid understanding of the mechanisms behind the reason why they're coming for treatment. And then after tongue and pulse and any palpation, we would look into treatment. So it may include acupuncture, which needles are typically retained for about 20 to 25 minutes, 30 minutes. If it's a pain condition, we may add some cupping or gua sha, which is a press stroking type technique. I use electrical stim as well in my treatments to
Can you explain what that is? What is
electrical stim? If anyone's, it looks like a little car battery. It looks like you're literally with little alligator clips hooking them up to the end of the needles, and we use a real low level stim, very low amplitude, and we provide extra stimulation to the needles.
Okay. Yeah, I think I've, again, experienced that before. Looks a little intimidating, but it's not at all.
It's not. It's a fantastic treatment to receive.
Yeah, wonderful. Okay, great. And with that, what are some questions that you get asked the most when you're in your clinic? Any stories or questions you've consistently heard from your clients, patients that you want to share today?
Biggest one I would say is pain. Does it hurt? I hear that all the time. Does it hurt? Does it hurt? Does it hurt? We have so many different types of needles, different gauges, different lengths. We get into ones that are coded for painless. If you're going to somebody that's qualified, that's properly trained, it shouldn't be painful. You might feel a quick pinch on insertion of the needle, but once the needle breaks through the dermis, the layer of your skin where your nerve endings are, it shouldn't be painful. Now, we do need some sensation to send those relay signals back to the brain or wherever, whatever the targeted tissue is, to get the response to the system. But it shouldn't be an excruciating, painful experience while the needles are retained.
Okay, so if someone's feeling that pain beyond what is acceptable, then something perhaps isn't going correct.
Most definitely. I share with my patients the first time I start putting needles in, if anything feels more aggressive than a small tap, tell me. You don't have to suck pain up with our needles. It's not like you have to suck up an IV that's being put into your arm, or, you know, an inoculation that you're given. We can angle our needles and try and get away from perhaps some of those nerve endings that we're a little bit too close to.
Okay, great. And then the last question around this topic is, when someone comes and sees a TCM practitioner / acupuncturist, what kind of outcomes could they see? Assuming they're focused and they're coming to their appointments and, you know, being on top of things, what does progress look like for this type of person?
That's a great question. And what we find, it really does vary. Depends as well on the condition that the patient is seeking care for. If it's an acute condition, we can generally seek some sort of resolution very quickly. If somebody has, let's say, an acute heat rash, we can help clear that quite quickly. If it's been chronic low back pain that has been insidious for 20 years, that's going to be more about management. So with that type of case, we'd be looking at activities of daily living. Are we decreasing pain? Have we increased function? Are the activities of daily living becoming easier for them to manage? What we notice with many of our maintenance type patients that have come to us, let's say for a condition, we've gained resolution in the condition, but they continue on with maintenance care. If they slide off the maintenance care before their body is ready, they start to come back. And we typically see that. So they may slide off of care for a couple of months, and then we start to get the phone calls or the emails that things are gradually starting to come back. So if it's an acute condition, we can generally expect resolution. Chronic condition, we work more with management of that condition to make you more comfortable and improve quality of life.
But it sounds like either way, people need to be committed and focused and dedicated.
Most definitely. I mean, we have a very clear example of success when I'm working with my fertility patients. They get pregnant. So, you know, it's what we get to do daily. My associate and I talk daily about how blessed we are to be able to practice this medicine and share it with the public.
That's awesome. That's a fantastic way to kind of end this series now. And I always like to let people know, you know, whether or not your services are covered under health benefits. Some people have them, some people don't. But for those who do, if someone were to come and see someone like you, would they be able to get it covered?
Yes. So that depends purely on the benefit plan choices by the company, but most insurance companies now do provide coverage for acupuncture. Herbs are not covered, so the cost of the herbal formulas will not be covered, but acupuncture, the services are covered by most insurance providers.
Okay, great. Okay, wonderful. Is there anything else you wanted to add to our little chat here? Or I think you did a great summary.
Thank you so much for allowing me to highlight and to showcase what we get to do every day. It's a beautiful medicine, and I am excited for more people in Ontario to begin to experience it.
Wonderful. And with that, I want to say thank you very much, Christine Lang. She is, again, a TCM practitioner and acupuncturist at Lang Wellness Center in Barrie. And again, thank you so much in helping us understand more about TCM and acupuncture.
Brenda.
Wonderful. And with that, we'll end that. Thank you very much, everybody.
Thank you.